talk about the kidneys. The kidneys are really unique because they're intimately connected with our musculoskeletal system. Embryologically, the kidneys develop as part of the mesoderm. The mesoderm moves us, basically. The mesoderm is a layer of embryo that turned into our musculoskeletal system. So it is the only organ that is connected in that intimacy of being part of our movement system. Likely it has something to do with the role the kidneys play in filtering our fluid system. So Philip Beach talks about the kidneys as being part of this fluid field. And the fluid field is really important because thinking about all of the fluid really makes the shape of our bodies, supports our blood pressure, lymph flow, vascular needs, waste removal, and literally creates or fills up the space of our fascia, right? And that is, like I said, what creates our shape. So the kidneys are something that comes up a lot when we talk about visceral manipulation or visceral mobility in relationship to movement. So the other unique thing about the kidneys is that they're not attached to our skeleton through ligaments. All of the other organs inside of us are attached to ligaments. The kidneys sort of are suspended along with this renal fascia and fat around them. They're sort of suspended from a phenomenon like in the atmosphere or a suction phenomenon because of the pressure of our cavities. And so it's very unique in terms of how they move with our breath, how they relate, and then the tendency for them to get injured or become pathological. So pathological kidney would be one that has lost the ability to move, so it gets stuck or adhesed, or has started to droop down towards your pelvic cavity, right? So it's sort of gravity is winning and it's pulling it down. So a kidney that's dropped down but is still mobile, can move all around, that is less pathological than a kidney that is even in the right position but stuck. So allowing the kidneys to move is a really important thing. So with that, let's talk about what you might find with somebody whose kidneys are not moving optimally. You're going to find that they're lacking trunk rotation because the kidneys sit right at our thoracolumbar junction, so they're intimately involved with rotation. So part of that rotation too is what drives this fluid field, this fluid system. It's sort of like if a towel is wet and you're wringing out the water, right? You twist it to help move the fluid. Our body is set up like that too. So someone would be lacking trunk rotation. They also may be lacking hip extension due to the relationship of the kidney and the hip flexor, the psoas muscle, as well as even have impaired psoas flexion, so limited strength into hip flexion. So that is the unique way the kidneys, so we talk about how they move. When we take a breath, the kidneys, right? So if you think about where they sit there, find your belly button, come to the side and come up just a little bit. The left one is a little higher up than the right kidney because of the liver. So when we take an inhale breath, the kidney slides down the psoas muscle like a slide, right? Like literally like a slide in the body. So the kidneys slide down the psoas. They actually tilt forward. So they forward bend, slide down, and they externally rotate. And then as we exhale, that reverses. So internal rotation, slide up, and return to that more neutral position out of the forward bend. So as you can see too, this ends up having a little bit of a medial and a lateral glide component too. So as we inhale, kidneys come down, out, and away, and then exhale together, in and up, right? So understanding that mobility is important, especially if you're evaluating them, but it's also can be used as a way to embody movement in them when we're doing our breath work. So we'll play around with that. But first, let's test some things. So what we will test is just trunk rotation. So we'll check my trunk rotation, just like we'll go hands bent, because they're going to be bent in a second too. We'll rotate to the right, see what I got, see how it feels, and to the left. To the right, feels a little restricted, to the left, more restricted. If I want to see if the kidneys are involved at all, I'm going to go ahead and just place my hands sort of where the kidneys are, and this sort of just gives a little assist to the movement of the kidneys. You don't have to press really hard if you're in the right spot, and then just imagine those little kidney beans there. Sort of let your hands sink in the soft tissue, and then rotate. You'll see that my mobility changes quite a bit. If you're not convinced you're palpating them there, you can actually place your hands at the back of your body where the kidneys are, in this space sort of underneath the rib cage. And at the bottom of the rib cage, it's sort of like that soft spot where your QL muscles are. It's called Grunfeld's triangle. If you've ever had a kidney infection, you'll know exactly where it is because it's where you were painful. But you can just gently press on that spot. And again, think about like I've got the kidneys with me, and test your rotation. So again, my rotation feels better with both anterior palpation and posterior palpation. You could also check hip flexor, strength, control, right? So if I did that, just looking at how high I come up, the path of which I come, how easy it is, how heavy my leg feels. My left feels a little heavier than the right. And then we can go through that embodied breathing in standing and seated, or we'll do one more supportive movement drill for the kidneys as well. What you don't want to do is do a lot of manual therapy and try to press in there. Unless you have a very skilled hand and have been taught how to palpate the kidneys and treat them manually through visceral manipulation, I would advise against any deep tissue in those areas. This is because you can damage the kidneys, you can irritate them, and the quickest way to feel like crap is to irritate your kidneys. When your kidneys are not feeling good, your energy really wanes. You're gonna feel extremely fatigued and tired. So let's do the breathing again. And we're just gonna, I like to embody the organs with my hands. So they're like smallish kidney bean size here, right in this area. And they sit a little closer together at the top than the bottom. And again, as I take an inhale breath, I'm going to inhale through my nose, and I'm going to imagine my kidneys sliding down the psoas, folding forward, opening up, and then exhaling the reverse. So inhale them down, sliding along the psoas, opening up, and back. And these are little movements. The kidneys move about 1 vertebrae distance, maybe 2. So it's little, but it's there. So I'm going to stop talking so I can breathe with this motion in my hands. So again, my hands are mirroring the kidneys. One more. Then I'll go ahead and recheck my rotation. And already that gives me a lot more rotation. And this is funny, like you heard me laugh a little bit because this is what my clients, my athletes will do too. We'll do something really simple like that. And the result will be so profound. They'll be like, how did you do that? Is that magic? And it's not magic, it's just that we are, again, bringing our attention to the movement of the organ, which does help the movement happen. And we can check my hip flexion, and that is like so much stronger and more stable. On this side, it's higher up. So again, like I definitely affected the kidneys. It wasn't just a breathing exercise. Now, you could argue that doing just a nice breathing exercise, maybe I have that same result, but what you want to ask is why? Why did you have that result? Was it from an increase of stability, or was it from mobilizing the right organs, getting the organs to move happy, and your body granting you that mobility? Depends on your lens of view, but I would argue when it is that effortless of a change, it's more than likely a visceral effect, especially when I confirmed with these inhibition tests before we even started to notice that it's like, yeah, if I do something in the kidneys, it's going to make a change. So another way you can affect the kidney is with a supine supported like decline position, allowing the kidneys to sort of come back up in that top position. This is especially important if you think one of your kidneys or both of your kidneys are in a little bit of ptosis, which means they've dropped down a little bit. Indication of this might be some femoral nerve type irritation. It's more likely to happen on the right side than the left side in general. And then the other thing I won't demonstrate but is helpful to do is using a soft massage ball like the Franklin ball or a Coregeous ball in the space of the lateral raphe, which is right where the fascia connects from the abdominal muscles into the erector spinae muscles in QL there. Doing self-massage and breathing in that area, very gentle, is really helpful to create some space and lift of those kidneys as well. So this is a great way to support the kidneys. Like I said, when you feel like there may be toast being P-T-O-S-I-S, not toast like bread, or just need something sort of regenerative and gentle for them, you can do this. Sometimes also putting like a warm compress in that area of the thoracolumbar junction can be really helpful in re-energizing as well for an unhappy kidney or kidneys. But you're going to have a support that you can bring your hips up, and you're just going to lie down on your back. Lift that support, those pillows, underneath your pelvis. So you're bringing your body in this declined position. Once you're in a declined position, you can again embody the kidneys if you'd like. Already, we're allowing gravity sort of slide them back up a little bit. And then when you inhale through the nose, you can imagine the diaphragm opening up, pressing them down and forward and out. So it's like a diaphragm push-up, but gentle. The emphasis on the exhaling, feeling all the organs, not just the kidneys, but all the organs slide up toward your head. If you have a Bosu ball or a Pilates arc, you can flip that over so it's a rocker, and you can rock back and forth with your breath to facilitate that sliding of the organs as well. So we'll do a few breaths here. And then recheck our thoracic rotation and hip flexion performance. Once you're done, you'll gently lift your hips up, come back down, and notice how you feel. When you're really focused on the kidneys here, what you may feel after you bring your hips back down is not only a change in how your pelvis feels, but width across the thoracolumbar junction, and that's exactly what I feel right now, which is very nice feeling. So let's go ahead and recheck my rotation and my hip flexion. See if I got any more than I did with the breathing. So from here, let's check the rotation. Oh yeah, now I can almost see all the way directly behind me, to the right and to the left. Definitely the most symmetrical I've been in a while. And then we'll check our hip flexion. Great. Check this hip flexion. Awesome. So this was talking about the kidneys, their role in movement, an easy, simple way to affect them, and hopefully gets your mind thinking about why certain interventions help. Have a great day.